Checkups are important. Every health department wants older adults to come in for health screenings. But instead of the people coming to the hospital, what if the hospital came to the people? Changhua County Screening Outreach does just that. Changhua Community-Based Integrated Screening began its pilot program in 2005. It tests 400 to 600 people at each session and sees over 10,000 people each year. It goes by the acronym CHCIS, and participants are contacted by the local health department and invited to one of 31 locations throughout the county. When they arrive, participants begin a trip around 22 stations for tests and exams that target the most important health issues for adults over 40. The process begins at 6:20 in the morning when the on-site activity center opens and volunteers hand out questionnaires. Changhua has scorching summer temperatures, so outdoor waiting areas must be covered. Each participant gets a questionnaire with a unique number that they will carry through the day. A digital smart registration system uses the National Health Insurance Card to check eligibility. At the blood test station, each participant is given 3 blood collection tubes. To help reduce the chances of error among hundreds of participants, the staff will help label the tubes and recheck IDs before blood samples are taken. After leaving the blood collection area, participants can pick up breakfast snacks before proceeding to the next station. The next step is completing the questionnaire. Staff are available to help any participants who have difficulty reading or filling out the forms, and then will measure and record the participants' blood pressure. The survey contains detailed questions about personal and family medical history. It creates a thorough baseline profile for each participant. Chest x-rays are next on the list. Staff will check IDs again and direct people to a self-contained mobile facility where they can change clothes comfortably and in privacy before and after their x-ray. For women, the Pap smear station provides a private and respectful environment for collecting a Pap smear. The vision exam station conducts visual acuity tests. Next, participants receive stool collection tubes and instructions on collecting a sample at home. Tubes are later returned to local centers for testing.
In Taiwan, we use fecal immunochemical tests as the primary screening tool in our nationwide colorectal cancer screening program. The screening was able to reduce the risk of colorectal cancer mortality by 30%, according to our recent analysis. It was also demonstrated that two-sample screening has significantly higher detection for proximal cancer and early-stage cancers, filling the deficit of the current one-sample fit screening.
Gastric cancer is still a very important healthcare problem in Taiwan. And in Changhua County, we have especially designed an effective strategy to screen for the Helicobacter pylori infection, which is the most important causes of the gastric cancer. So we use this strategy to implement in a large population, and we combine two stool tests that includes the fecal immunochemical test and the Helicobacter pylori stool antigen test. That is the so-called 2-in-1 screening test. So this is a very normal strategy to combine the primary and the secondary prevention strategy, and that is we currently use the a so-called 2-in-1 prevention strategy in the Changhua County. We believe that that will substantially reduce the burden from the colorectal cancer as well as the stomach cancer in this high, relatively intermediate risk population. Thank you.
In this step, participants receive a basic exam and consultation from a physician. Because smoking and betel nut chewing are common in Taiwan, participants are screened for oral mucosal lesion. Height, weight, and BMI are measured and recorded at the next station. Participants are given a specimen cup to take to the bathroom, then return urine to the collection area. Testing pulmonary function to screen for lung disease is a simple procedure, but it still requires a bit of help and explanation from a technician. The test uses a spirometer with a disposable mouthpiece and shows results immediately. Because particulate pollution is elevated in Changhua County, testing pulmonary function is important, and this procedure screens for several pulmonary problems at once. If participants showed elevated blood pressure on the first test, a second test is done here. This is the last stop of the day, where questionnaires are finally checked and turned in. Participants answer a few questions about their satisfaction, and then they head home with a reminder to come back in 2 weeks for their results. One-on-one consultation is especially helpful for older patients to get maximum results with minimum confusion. When women return for their test results and Phase 2 consultations, they can get a mammogram at the same time. CHCIS requires massive coordination between different departments and agencies to be successful, which is where county officials come into the picture. In Changhua, this has produced a win-win situation. For the public health department, having the support of a mayor or city councilor can never hurt. And for elected officials, volunteering in person for CHCIS events is an unbeatable opportunity to meet their constituents face to face and put their best foot forward as public servants. Usually, several dozen trained volunteers assist at every screening and are another essential element in the program's success. Many of the volunteers are health professionals trained by the County Health Bureau, and others are from local schools and community organizations. This substantially reduces staffing costs and gives the testing areas a friendlier neighborhood feel. Volunteers perform a variety of small tasks to assist both screening participants and staff. Designing and monitoring this program required over 100 meetings by specialists from Changhua, as well as other areas, over many months. The Health Service Planning section makes sure that CHCIS patient information can be quickly and easily aligned with Taiwan's national healthcare system. Lab samples must be properly handled and recorded for a screening event to succeed, so Changhua County lab technicians do on-site monitoring at every event to ensure the reliability of the testing process. Each X-ray is ultimately checked by a radiologist. The Public Health Nutrition section measures BMI and gives participants referrals and advice on nutrition-related diseases. Changhua County's Public Health Promotion Section is responsible for preventive medicine outreach, such as campaigns to promote pap smears and mammograms, tests for high blood pressure, colorectal cancer, and H. pylori. Their public health campaigns put a special emphasis on the need for regular medical checkups to counter the more traditional belief that people don't need to see a doctor unless they're sick. For CHCIS, the importance of teamwork simply cannot be overstated. Mobilizing so many departments is a huge task. So give us a moment to show off our teams. Aside from the health promotion section, there is the food safety section, the general affairs section, the accounting office, the medical affairs section, the civil service ethics office, the personnel office, the medical lab section, the pharmacology section, the health inspection section, the disease control section, and the health service planning section. The director of Zhanghua's Public Health Bureau, the deputy director, put in countless hours alongside their staff. And despite all the medical technology involved, the magic ingredient in the success of CHCIS is the sense of a community taking care of its own people.